Good afternoon, fellow partners of Oasis. My name is Gabriel Buendia, and I'm going to introduce you to Instituto de Fotomedicina. The first question you may have is, what is photomedicine? Well, photomedicine is a branch of medicine involving the study and applications of light through the whole therapeutical process. We can use it in diagnosis with classical tools like dermatoscopy, or we have now at our reach novel imaging techniques such as in vivo confocal microscopy or even Raman spectroscopy. We can use it in the treatment with lasers, which are well known for a long time, or with techniques such as photodynamic therapy, or even the use of gold nanoparticles that is nowadays very trendy, and many groups are researching it. Finally, we can help the patient in his recovery with photomodulation to help him activate muscle or metabolism or remove the pain, or with low-level laser therapy. The next question is, who are we? Who is Instituto de Fotomedicina? Well, we are the photomedicine and laser service of a private clinic named Hospital Quirón Tecnon, and we are such since 1998, which means we have a long time of expertise with lasers and photonics in general. We are a team of scientists and physicians involved in photomedicine, experts in its use, its application for healthcare, and we have more than 15 devices, mainly lasers, at our disposal to do so. We also have light-based devices for measuring the skin, for evaluating cosmetics, and I will talk about them later. We are working mainly in dermatology and in surgery. We perform around 2,000 dermatology treatments each year, ranging from aesthetics to more clinical. Hospital Quirón Tecnon is a high-end private hospital that has around 800 doctors in all the specialties, has an ER room, and has many facilities that research and teaching possible, with more than around 12 and or 19 OR rooms, depending of what kind of operation we want to perform, and an auditorium with a capacity for 150 people where we can stream the operation, so we can teach, show, present clinical evidence to a big audience. And thus we are the perfect environment for both clinical and research. With all this, how can we help other photonics businesses in the biomedical world? Well, as it happens, engineers and physicians don't understand each other. Generally, they speak different jargons, they have different outlooks of the same problem, and are not very often in contact. It's like they were walking in two different sides of the same street. So there is a need for a team capable of understanding both the engineering and the clinical language, and to establish interactions between both of them. Examples of those are the 3D skin metrology that can be used for both face and body, used mainly for aesthetic studies, for devices, for cosmetics, for color evaluation. We also have the in vivo reflectance confocal microscopy that allows us to make accurate follow-ups of the skin tissue without making a biopsy. We could also use other techniques that are also very nice, like UV fluorescence photography or IR thermography. Or we can help you develop new techniques. Having the know-how of how these techniques are used, how the industry is looking for them or is looking for new things that can replace them. And as such, our contribution to technological development can be very broad. We can be of help before it happens with our clinical background. We can help you establish needs or applications where a new solution is needed, or maybe help you define better in which field the project you want to create maybe more fitting. We can then we also know our know-how, our knowledge can be of use. We can help you with specifications, which, as we all know, are normally a hurdle when we present a European project. Or if you happen to already be in the middle of a technological development, we can help you with the testing. We can help you with processing or understanding the information you're getting from your development in order to reach the goal safely. Or if you already have a product, if you already have a device that you want to, that is not already working on the biomedical field, but you want to adapt to the biomedical field, we can help you with the validation of this device. We can help you establish the methods of use, the protocols, the clinical protocols, the routines needed in order to apply it to the biomedical field. We can conduct clinical trials in order to prove the safety or the efficacy of this device in the medical field. Or we can find new applications, new uses of this machine that is already there in many interesting projects. Thank you for your attention, and I hope to meet you very soon in Barcelona.